I'm joined by Dr. Roberto Pili of Great Lakes Cancer Care Physicians. Thank you so much for joining me, doctor.
Thank you, Chelsea, for having me.
Why don't you start off by telling us about what you do with Great Lakes Cancer Care?
Sure. I'm a medical oncologist, and I have also a position at University of Buffalo as Associate Dean for Cancer Research and Chief of the Division of Hematology Oncology, and I'm also Vice President for Oncology Service at Great Lakes Cancer Care. I do research for patients with cancer, and I do see patients who have specific disease.
Okay, so let's talk about the role that nutrition can play in the treatment for cancer patients.
I would like to start probably define what we mean for nutrition. Nutrition is really healthy diet. And as you know, we need to maintain our body and we need energy.
Right.
And we are like a car. We need the gasoline or electricity. So we are producing energy. We are obtaining energy from a different source. These sources are proteins, sugar, carbohydrates, and fats. And these are breaking down on glucose, amino acid, and lipids. So, and each components are very important. So a balanced diet, we believe, is 20% getting source from protein, 40% for sugar, and 40% for fats. So the American Cancer Society has a really nice guidelines about cancer prevention, how diet and physical activity actually can help to prevent cancer. The recommendation is having a balanced diet, primarily focus on plant-based food, and keep the weight down, so physical activity, drink alcohol moderately. If you don't drink alcohol, probably is also better. But there's been some studies suggesting that population who eats a lot of animal proteins, perhaps they have higher incidence of specific cancer, like breast cancer, colon cancer, prostate cancer, and vice versa. If population they have a less consumption of vegetables, there might be less of this type of cancer, even aggressiveness of this cancer.
Okay, so there's been studies proving a high intake of animal products can lead to certain cancers.
Yes,
very
absolutely.
Interesting. So let's get more into what are those guidelines and those recommendations dietarily for cancer patients when they're undergoing treatment.
Very good point, and I think this is a shift in paradigm. We always thought about healthy diet and nutrition to prevent cancer, and definitely I think that is important. Again, a more plant-based diet, more a vegetarian type of diet, we believe it can help, and of course no smoking, no drinking. But we believe that these guidelines can be applicable also to patients who have cancer. So having healthy diet in patients who have cancer, who are receiving cancer treatment, can actually help to have perhaps a less side effect from treatment and maybe more activity from the cancer treatment. 10 years ago, with Dr. Fontana, is a very well-known nutritionist who pioneered how protein restriction can impact aging. We decided actually to look at how diet, reducing the protein in the diet, can slow down cancer growth in mice.
Wow.
And we look at breast and prostate. To me, it was exciting to see that just changing the amount of protein from 20% to 10%, we were able to slow down the cancer in these mice.
That's huge.
Very, very, it was really, again, a high-opening experience for me that I didn't know much about nutrition at that time. And more interesting, the source of protein is important. When we give protein extra to these mice, it was only soy, for example, versus casein. Casein is the main protein in the milk.
Okay.
Cancer in mice receiving soy was slowing down. Same amount of protein, 20%. But if we give casein as the main source of protein, the cancer actually was growing faster. So that's the reason why to my patient, I always recommend, if possible, to reduce or cut down
dairy.
Cow milk, dairy products, perhaps reducing red meat, egg yolk, again, transition more to a plant-based diet.
Nice. Okay, so dairy and meats, those are specific food groups that people should try to avoid when they're part of the Cancer Society.
I think this is something that is definitely now recommended, and of course it's not easy to do it, but at least try to shift the diet more to a plant-based diet, more fruits and vegetables, and of course physical activity is very important.
Right. Now we have your recommendations of foods to avoid, but let's talk about how nutritional support can actually improve a patient's overall well-being and recovery. What does that look like?
This is a very good question. Again, we know now that there are evidence that having a nutritional support, meaning to have access to a dietitian who can follow this patient, especially when a patient has surgery, stay in the hospital, can make a big difference. We are creating a snack center at the University of Buffalo and Great Lakes Cancer Care. It's called Science and Nutrition and Cancer Center, where we actually try to study more how specific dietary restriction, whether it's a protein restriction, reducing the protein, or calorie restriction, can actually improve the well-being of this patient receiving chemotherapy.
Let's go back to the snack center because you've touched on it, but this is a really special place.
It is a special place. Again, it's more virtual, but we have a space dedicated in the Clinical Translation Research Center at University of Buffalo, where patient actually gets seen and followed by the registered dietitian for 3 or 4 months. And we see whether a calorie restriction or a protein restriction can actually improve, for example, response to immunotherapy. We have a very intriguing data in animal study that if we reduce the amount of protein, we can actually boost the immune system. But this has to be done on a personalized level. Right. So this snack center and clinic really give us an opportunity to provide access to a registered dietitian, but also to the science, because we are collecting samples and we try to learn more about each individual patient, whether that specific diet may be more prudent.
Right, because these are clinical trials.
These are clinical trials. So that's the reason why we constitute this center, because again, it's snack without decay, science and nutrition and cancer, because unless we do within a rigorous approach with the clinical trials, it's hard to probably to advance the field. So we're really thankful for the patient that donate their time to participate, and encourage everybody who has cancer and undergo cancer treatment to learn more about these clinical trials, because no matter what they're receiving the treatment, they can come and we can provide this dietary consult for now actually free of charge. So that's a plus.
That's huge. Dr. Pili, thank you so much for coming in.
It's been a pleasure. Thank you
talking
for
about
the
the power of food as medicine. Thank you so much.
Thank you.
To find out more about their cancer treatments, visit their website, greatlakescancercare.org.